Hi, this is Dr. Frez at the Chiropractic and Injury Center. Today we're going to be talking about sciatica, a complaint that quite a few patients come into the office with. My guess is it's excruciating. Fortunately, I have not had to deal with it myself, but I have had to deal with it as far as the patients go. And with sciatica, what we find is if we look at this chart here, we're looking at this woman from the side, and the lumbar spine, which is the lowest part in through here, what we look for is we want to make sure that there's a curve. And the way we're looking at it is it should look like a reverse C. And that's important because the head is heavy, the torso is heavy, and as the weight of the upper part of the body comes down, you want that curve, you want that springiness or give. Think about a shock absorber. When you go over a speed bump in your car, right, the shock absorbers distribute the weight. Well, this curve should distribute the weight of the lower part of the body, right, to distribute it. What happens is, over the course of time, is that curve begins to straighten. When it does, it loses that springiness or that shock absorbing effect. What happens is if you look at these mustard colored dots here, they form something called the lumbar plexus, and these dots are where the nerves come through, and that's what basically forms the sciatic. So when one of these mustard colored dots where the nerves come through gets pinched, it can cause sciatic nerve pain, it can cause symptoms into the lower legs, the ankles, the feet, and even into the toes, okay? So if we switch and we look at the spinal nerve chart, the sciatic nerve is this real thick yellow nerve. It's about the size of a Sharpie pen. So again, what happens is, as that spine starts to straighten, these nerves will get pinched. When the nerve gets pinched, that's what sends the numbness, the tingling, the burning sensation, usually into the back of the leg, but again, it can go all the way down, sometimes even into the feet and into the toes. Like I said, it's excruciating. Lots of people coming in tears sometimes with sciatic pain. So what we do as the chiropractor is go in, we get whatever spinal segments are out of position, we put them back into position. And what we want to do is we want to recreate that curve, that springiness or that give. When we do that, it causes the muscles to relax, gets the joint functioning again, but most importantly, it takes the pressure off of that nerve, and then the patient begins to feel better, okay? That's sciatica. If you think that it's something that you may be suffering from, again, come into the office. We have health certificates. We have ways to come in. We'll do our consultation. We'll do our exam. We'll take some pictures, and we'll see if that's really not what the issue is, all right? This is Dr. Freza. Thanks for watching.